Excellent. Thank you, Nancy, and welcome everybody on this Thursday afternoon. We do have a lot of information to cover, and so we are going to jump into it. Welcome to Saltmarsh Cleveland Guns CARES Act PRF reporting instructions and recent update. I think this is number 5 in this series. We're holding this webinar out as current as of August 31st. There's been a lot of new information published at the end of August. We've tried to incorporate all of the most recent information, with a caveat that we are still getting new data and new guidance, and things are changing on a routine basis. So always refer back to the HRSA website for the most current information. Today's agenda, and let's see if we can get moving. There we go. Today's agenda. We're going to have a quick overview of the updated periods of availability and reporting periods. This is an area where we're still getting a lot of questions. We're going to walk through the portal reporting process, kind of step by step. As we walk through the portal process, we're going to try to go over and highlight some of the updates on recently added or modified frequently asked questions, including those covering estimating COVID expenses and calculating lost revenue. And as Nancy said, we will try to get to any questions. Please feel free to put questions in the chat. If we can get to them during the webinar, we will. If not, we will follow up with everybody after the webinar is complete. So this is a process in accountability to the federal government. Unlike these two guys here, actually accounting and accountability have a lot in common as you go through this process. There is a lot of both going on. And with that, I'm going to introduce my my colleague in the webinar today, Claudia Reingruber. And Claudia, you want to jump in and take us through the recent updates to the guidance?
I will. We're really happy to see so many people joining, and there's a lot of information to go through. We struggled to figure out how to get it all in within the time period that we have. So it's important. We wanted to make sure to mention that if you're looking for the PRF information, it is moved. It's now been relocated to the HRSA.gov website. That happened about the middle of August, and there's the link for you. We also have some resource pages at the end that will contain the new information also. So if you've if you've tried to click on the HHS website, it no longer pops up with the PRF information. It takes you automatically to HRSA. And then in addition to that, we still have the June 11th, 2021 post-payment notice of reporting requirements, and that has remained in effect without modification, although there's some additional clarifications that have been issued, as Andrew stated. In August of 2021, you're going to see that there have been a number of new resource guides on the portal, on the HRSA website, and that includes a lost revenue guide and a resource guide for reporting period number 1 specifically, and some other helpful information. There's also an updated PRF reporting portal user guide. So if you printed off the initial user guide for reporting purposes, you will want to go back in and check out the August 16th, 2021 version. And there are updated frequently asked questions, and those were last updated as of August 31st, 2021, which is why we have stated that that's the date at which we're certain, or as certain as possible, that the information we're providing you is accurate as of today. There's a number of changes. We can go on to the next slide. This will differ from the chart that you see in the June 11th Notice of Reporting guidelines. There's a new terminology for the period of availability. This is good news in that if you look at that yellow column, you'll note that each period is retroactive to January 1st, 2020, meaning that the period in which funds are available has that level of retroactivity. So I think that's an important distinction and something that you'll want to keep in mind when you're reporting. There are a number of webinars that are available on the CMS or the HRSA website, including a new one that was just posted that will be tomorrow. If any of you are able to listen to that, there's a PRF reporting assistant office hours that is labeled to continue for an hour and a half. It's tomorrow afternoon. There's a link at the end of the presentation in the resource guide. There's a direct link. You don't have to pre-register, so anyone can listen to that as well.
Excellent. And Claudia, and I think that the yellow column really just highlights something, and we're going to touch on this throughout the presentation today, that as we go forward through this reporting period and the next reporting periods, providers are going to continue to be able to look back to January 1 of 2020 to pick up lost revenue and expenses. So to the extent that they aren't all used or consumed in this first reporting period, you're going to be able to continue to look back all the way to January 1 and use those funds.
Right, that's an important point to stress so that everybody understands that they have that flexibility. The June 11th notice established these 4 payment received periods. And instead of having looking at the year as a whole in terms of how much you've received in order to determine your reporting obligation, now for each of these payment periods, your reporting obligation is based on the amount of PRF funds you received during that reporting period. So, you know, if you, we mentioned that the first reporting period, for example, covers, goes through June 30th of 2021, and so that any payments that you receive during that initial reporting period, payment received period, is from April 10th, when the first payments were issued, through June 30th of 2020. So if during that period of time you receive $10,000 or less, you do not have to report at all. If you received more than $10,000, then you must report. And if you received more than $500,000 or $500,000 or more, you must report in more detail. So Andrew's going to go through those reporting requirements a little bit later, but it's really important to realize that those are by reporting period. So each of the 4 reporting periods, the first one ending June 30, and then the 6 months from July 2020 to December 2020, and January 2021 to June of 2021, and then July of 21 to December of 21. Each of those 4 periods, you're going to look at how much you received to determine whether or not you're obligated to report.
And Claudia, just to a point of clarity, because we're talking about June 30, and June 30 comes up a lot. There are, for this first reporting period, there are 2 June 30s that are important. There's June 30 of 2020, which is the date that you're measuring your payments. So you're reporting for this first reporting period, you're measuring payments received through June 30th of 2020, but you're reporting on usage of those funds through June 30th of 2021. And that can often be confusing, I think, for folks as they're trying to look and figure out these dates.
Right. Yeah, that's a good point, because really that yellow column is very important because it gives you from 12 to 18 months to be able to spend the funds that you received. So the dates in the period received column and the period of availability are significantly different and give a lot of opportunity, I think. And going on to the next slide, the reporting period for period 1 must be completed by September 30th of 2021, which is coming up at the end of this month. It's important to note that the deadline is 11:59 Eastern time. So if you're in a different time zone, and we know many of the participants are, make sure you have that, you know, date and time in mind. And if you're in a different time zone, adjust to Eastern time to make sure you don't miss the deadline. And it will cover, as we said, payments received from April 10th, 2020 through June 30th, 2020. But these funds are available to use all the way back to January 1st of 2020 through June 30 of 2021. So that's an extended period of time in which the funds received can be used. The PRF reporting portal, as we said, has been moved. So now it's on the HRSA website. Here is a link. And I'm sure everyone or nearly everyone has registered in the portal. You can't report till you've registered. Hopefully you've already accomplished that. And if not, HRSA has provided user guides both for registration and reporting, and there are also tutorials for both registration and reporting. And these will be very helpful to you if you've not had a chance to look at those. And with that, I believe the next slide, Andrew, is up for you.
Oh, thanks, Claudia. So responsibility for reporting. We're going to touch on this at a couple steps through the presentation today, but at a high level, the responsibility for reporting falls on what is called the reporting entity. And the reporting entity is the entity that registers its TIN, or tax identification number, and reports on the payments received by that TIN or its subsidiary TINs. And so you've got some different buckets that you can fall into here. You can be a general distribution recipient that received phase one only. And we're not going to get too deep into discussions about the difference between general and targeted distributions today. You can go back and watch one of our prior webinars. They're all available on YouTube if you're interested. But the buckets are general distribution recipients that receive phase one, a general distribution recipient with no parent organization or subsidiaries except PRF recipients that receive phase one general distributions. You've got your general distribution recipients with one or more subsidiaries that received multiple general distribution payments in phases 1 through 3. And then you've got targeted distribution recipients. And many of our clients on the call today, we know are in the long-term care industry, skilled nursing facilities. And so almost all of those facilities really should have received some sort of targeted distribution recipients. And it's important to note that if you have a subsidiary that received targeted distribution payments, the original recipient of the targeted distribution payments is always the reporting entity for those payments. So if you're a parent organization, you can report on both the parent's general distribution recipients, if it received any, and the general distribution payments that were received by your subsidiaries. But the subsidiary is always going to have to be registered separately and report on those targeted distributions separately. And we're going to talk a little bit about how that actually works in the portal here in just a couple minutes. Claudia, anything you want to add there?
No, I think that's good.
All right. The reporting process, the Provider Relief Fund portal, or the Provider Relief Fund reporting portal, reporting user guide, as updated on August 16th. This should be everybody's roadmap. I highly recommend before you start this process, save a copy of that PDF on your desktop, print a copy, go through and make notes. It walks providers through step by step with detailed graphics on how to handle the reporting. We're not going to go through that because it does such a good job. We're going to talk about some of the mechanics. We're not going to share with you, copies of actual screenshots. All that's in the user guide, but you definitely want to refer to that. The user guide covers the 16 steps of the portal reporting process. And there is a webinar on the mechanics of the portal reporting process, and we've given you a link here. I would also highly recommend that you watch that webinar before you start the reporting process. This reporting is just like the doctor here. The government's happy to help as long as you don't mind filling out some forms, and you're going to have some forms to fill out.
One other comment regarding that is I read through the portal reporting guide initially when it first came out, but it doesn't mean a whole lot, as much at least, until you start really trying to accumulate the information to begin entering it to the portal. And then you're going to find you have questions. So, it's probably something you are going to need to refer to, as Andrew said, multiple times.
Yeah, Claudia, that's absolutely right. And we actually provide links to this, I think, later on, but there is also HHS has provided, or HRSA now is provided, an Excel spreadsheet that has a set of tables that providers can use to kind of pre-fill information. I would recommend, have that that Excel spreadsheet pulled up, have that ready, and use that as you kind of walk through the reporting process. Those two tools together will help you get ready when you actually sit down and start reporting. So start walking through the steps here. Step one, once again, not going to get into too much detail. Step 1 is where you enter your basic entity information, including your name and DBA, provider type, address, contact information. One note that kind of flows through this entire process: as you're entering, you'll be required to complete all fields, even if it's putting in a 0 or a null. Otherwise, the portal will give you an error message in many cases.
You know, one other comment comes to mind too, and is if you remember going into the registration portal, you had to complete everything at once. That is not the same here in the reporting portal. But if once you're in a screen or once you're in a particular area, you do need to save before you exit. So I think, you know, we'll go through and talk about that a little bit as we proceed, but it is going to, you can do it in multiple steps. So that will make it a little bit easier for you, I think.
You can. You're typically given an option to save at the end of each step. So so steps 2 and 3, subsidiaries. So steps 2 and 3 cover the subsidiary questionnaire and the subsidiary data. So as a provider, you must identify any subsidiaries, including those acquired or divested during the period of availability. If the reporting entity is a subsidiary, you have to tell whether or not the parent entity will be reporting on the reporting entity's general distribution payments. So in other words, if you are in for a facility, and that facility is a subsidiary of a parent organization, you will have to tell the portal that whether or not you are reporting on the general distribution payments you receive, or whether your parent is going to be reporting on those general distribution payments. And if you received, if you're a subsidiary, you're going to have to note whether or not any targeted distribution payments that you receive. So these would be, for example, the SNF specific payments. You're going to have to let the portal know if any targeted distribution payments were transferred to or by a parent entity, and if so, the dollar amount transferred. And then step 3 is the subsidiary data. So what you're going to note throughout the portal process is that the portal process is dynamic, meaning you'll be presented with data fields based on the answers often that you gave at a prior step. And so depending on whether or not you've identified any subsidiaries in this step, you'll be presented with data fields in step 3, where you'll actually then provide things like the TINs and other information on these subsidiaries. And steps 2 and 3 are important because we go back, we've had a number of questions on how you allocate funds in between the parent and the subsidiaries, and this really becomes the process. Steps 2 and 3 are where you're identifying, if you're a parent, you're identifying your subsidiaries, you're identifying whether or not the parent or the subsidiary is reporting on the general distributions, and you're telling the system, if you're a subsidiary, whether your targeted distributions have been transferred to a parent and then on to another entity. And that's important because that then takes us to step 4. And in step 4, the system will take the information you put in and then automatically calculate or identify all of the PRFs that you are reporting on for this period. So in other words, if you're a parent and you've identified that you're reporting, the parent is reporting on the general distribution funds of its subsidiaries, those general distribution funds will then appear at step 4. And at step 4, you'll be presented with a spreadsheet that you'll download. You can see all the funds that you're reporting on. You'll be given the TIN, the payments were originally made to, the distribution type, the amounts deposited, any amounts returned, the amounts retained, the attestation date. And you'll have to certify that this is correct before the portal will allow you to move on. And if it's not correct, you're going to have to initiate a dispute process. And so, and that's going to recall calling the provider information hotline and initiating a dispute. But this is really the place where you're making that allocation. And so it's important to think here, if you are a parent entity with multiple subsidiaries, and you may have some of those subsidiaries may have performed differently, and you may be wanting to transfer the targeted funds from a facility that maybe did not have a revenue drop and transfer them to the parent entity or another subsidiary in order to help make up for a subsidiary that did have a significant revenue drop. You'll need to have all that information ready when you go in and start the reporting process. So we would recommend you go through, you kind of do your calculations for each of your facilities, understand where you sit, And then you'll know then when you get to steps 2 and 3, whether or not you're identifying were any targeted funds moved and who's going to be reporting on the usage of what funds. So steps 2 and 3, really key to these questions we're getting about allocations. And so in other words, at the end of the day, you're not allocating cost, you're allocating dollars received between the reporting entities and reporting on them. Claudia, anything you want to add there?
No, I think that's a really important point, though, because that is where we have a lot of questions. So they want to make sure that part of it is up to that point is correct.
Excellent. And then Claudia, I think from there, we're going to just, you're going to cover the distributions and the reporting periods.
Right. Just briefly, we wanted to go ahead and outline some of the payments that were distributed during this first reporting period. So we have the general phase 1 general distribution that was made based on Medicare revenues that was made in April, and also the phase 2. Some of you may have received Medicaid, CHIP, ALFs, and additional Medicare funds, or your first distribution of Medicare funds through the second phase if you didn't get them in the first phase. So also the targeted distributions. We had the rural health clinic, high impact hospitals had two different distributions. Skilled nursing facilities had a distribution, Indian healthcare had a distribution, and also the safety net hospitals. And this is just a general guide, just so you know where you're looking to make sure when you got your payments. This will give you kind of an idea of when you received payments during this reporting period 1. As Andrew mentioned in step 4, I believe you're going to automatically reconcile this information with what the government has. So that will be an important part of this process. And the second, we just included a little bit of information here on what was distributed during the second reporting period. You had some providers may have received that Medicaid and CHIP and ALF distribution in July. Also dental providers that under phase 2. Then we had the phase 3 assisted living providers and a phase 3 general distribution that may have been made to some providers who submitted additional information. We also have targeted distributions to children's hospitals. And then we had our first nursing home infection control distribution that was made in August. So there will not be, based on everything we've seen, there will not be any distributions of infection control funds in the first reporting period. Now that first infection control distribution was made in August based on $10,000, a flat amount, plus $1,450 per bed. So that was the first one, and will not appear in that first reporting period that you will be obligated. That will come in the second reporting period. And also in that second reporting period, this is where the QIP payments started to be released, and those were the September performance period, likely in November, and the October performance period, likely in December. And there are two components of this payment. There's the infection rate and mortality rate and separate distributions. So you may have gotten an infection distribution based on your rate of infection based compared to other the infection rate in your community or your county, and the mortality rate was based on the mortality distribution was based on the mortality rate, which compared COVID death rates to a national threshold for COVID deaths for nursing home patients nationwide. So there may have been multiple payments for each of these performance periods, and those will fall into the second reporting period.
So Claudia, we do have a chat question I think we can cover really quickly. And the question is, can a parent organization use the funds from a wholly owned subsidiary to offset the loss of revenue and expenses? And the answer is yes. You are allowed to, a parent company with a wholly owned subsidiary is allowed to redistribute both general and targeted distribution funds between the parent entity and or other wholly owned subsidiaries, so long as they're used for the qualified expenses for COVID-related expenses, correct? All right, thanks, Claudia. So steps 5 and 6, once again, these are pretty straightforward. Steps 5 It will be simply where you'll be entering any interest earned on PRF payments. It's, unlikely that anybody earned any significant interest on PRF payments, but that you do have to include that as part of the PRF payment overall. You also have to provide certain tax classification information for the entity, such as S Corp, Schedule C, C Corp, that sort of thing. And you also have to provide information on your single audit requirements and whether or not you believe the entity is going to be eligible for this single audit requirement. And so keep in mind that that's $750,000. The threshold there is $750,000 expended or used in a calendar year. That is going to be a different threshold than your reporting period thresholds. So you could have reporting period thresholds where you don't meet the $750,000 number, but overall you may have $750,000 in a calendar year. And then step 6 is a payment summary. So once again, this is just one of those auto-generated pages where the portal is going to automatically generate all the information you've keyed in so far. Step 7, other assistance received. So providers at this stage are going to be reporting all the other assistance you received outside of PRF funds. That's going to include RHC COVID-19 testing, Treasury or SBA funding, including PPP loan program funds. We had a question about our PPP loans, 100% forgiven, subject to PRF reporting. Yes, you're going to report those amounts here. So if you received a PPP loan and it was forgiven, you're going to report that here. If you received an EIDL $10,000 advance payment, you're going to report that here as other assistance received. It's also going to include things like FEMA programs, HRS CARES Act testing grants, local, state, and tribal governmental assistance, business insurance, and other assistance payments. When you get ready to start doing this, we strongly recommend, this is HHS has provided worksheets. This specific worksheet is the worksheet on other assistance received in the portal worksheets file that's available on the HRSA website. It's not a very complicated spreadsheet. It's basically just a form, but it essentially lets you go ahead and kind of understand, pre-fill in the numbers that are going to go into the portal so that you're ready when you get around to the portal reporting process. And then Claudia, I think from there, we're going to talk a little bit about step 8, which is the reporting of infection control expenses.
Right, this is step 8, and this will only be part of your reporting if you've received a SNF or nursing home infection control distribution payment during the reporting period. So these are the expenses that you incurred. They're the terms and condition spells that out pretty well, and also subsequent FAQs, but these are costs associated with administering COVID testing, reporting, all the reporting you have to do of COVID test results and all the other types of reporting you do related to COVID that support infection control, hiring staff to provide patient care or administrative support, providing additional services to residents, and other expenses, everything that you've done to improve infection control. And I think, we don't want to take too much time here, but this is really important to make sure that you look and capture all of the expenses that you've incurred, not just by the people that you assume would be obviously associated with infection control, such as your infection preventionist and possibly other people assigned, to do the screening and to do the other things. But think about the meetings that you've had to discuss infection control and all the other time that your staff and department heads and other staff may have assisted with infection control. So important to really think that through and make sure you're not leaving something out. This is your opportunity to show the government and to demonstrate to them how much it really did cost you to all the efforts that you put into minimizing and doing everything you could to minimize infection and the spread of the COVID disease. And that certainly is ongoing at this particular point. So these are expenses that you'll be incurring for a while. Having said that, there were no infection control distributions received during this first reporting period. So this step 8 is not going to pop up for you to complete if you didn't report any infection control distribution receipts during that period of time, during this first reporting period. You will be officially reporting those payments that you received and the related expenses associated with them in the beginning in the second reporting period.
Excellent.
Anything you want to add there, Andrew?
I think that's a great coverage. Connie, we are getting a couple questions about on the other assistance received, for example, PPP loans. The guidance, what the guidance tells us is that you're reporting all of the PPP loans. And I think the same would go for if you're in a state where you've gotten supplemental payments related to coronavirus, you're going to need to report those as well under the other assistance received at step 7, the immediately preceding step. So as Claudia was talking about there, and we've touched on this briefly, as you go through the expense reporting for both infection prevention control and other COVID expenses, you're going to be falling basically into 2 buckets. You've got if you received for the reporting period between $10,000 and $499,000, you're just reporting expenses in 2 general categories. They're the G&A expenses and the healthcare related expenses. If you received $500,000 or more, you have to report in greater detail. And so that greater detail looks like this. You're going to have to report in these categories. So under G&A, it's going to be things like mortgage, rent, insurance, personnel, fringe benefits, lease payments, utilities, and other G&A. Under healthcare related expenses, it's going to be things like supplies, equipment, information technology, facilities, and just the catch-all other healthcare related expenses. Claudia, anything you want to add there?
No, I think that's good.
And you can take us now into step 9, where we talk about other PRF expenses.
Okay, and these are step 9 is all of the expenses other than infection control. These were expenses, we've heard this language over and over again, that were incurred to prevent, prepare for, and respond to coronavirus, knowing that every resident and patient is potentially a coronavirus case. These expenses should be unreimbursed by other sources or expenses that other sources have are not obligated to reimburse. The total value of those expenses can't exceed the total other general and targeted distribution funds received for the reporting period. And you have to report these by quarter as you go through the reporting periods, and they have to be positive amounts. And there's, as Andrew said, there are those worksheets there that will help you. And one of the questions that we received was, when reporting expenses that the payments were applied to, do we have to report total expenses anywhere for these quarters, or just the items that the relief funds were applied to? And in step 9 here, all you are reporting are the COVID related expenses, and only to the extent, in this step, only to the extent that they are being applied to PRF payments you received during the payment availability period. So you're not reporting total expenses. You're reporting anywhere through the portal. There's nowhere that you're reporting total expenses, only COVID related expenses.
And that's a great point. And actually, when you go into the portal is going to calculate how much other PRF funds you have to apply these expenses to, and it should not let you enter any expenses in excess of the amount of PRF funds that you have available. Claudia, I also want to point out that we say here other non-infection control, but you can actually use your other PRF expenses to cover infection control. We just want to make sure that everybody understands you want to hold those infection control related expenses and apply them to your infection control dollars. Your infection control dollars can only be used for infection control expenses. Your other PRF dollars can be used for any type of COVID-related expense, I believe. Isn't that?
That's right. And another important point to that is you can't use the infection control payments to cover lost revenues. So, you really need to make sure that you retain these COVID expenses to apply first to those the infection control distributions, because they're so restricted in terms of how those can be used.
Yeah, so it definitely is going to pay, and this is, to look and understand how much infection prevention control money you received, what your infection control expenses may be, you think, for the reporting period, and you need to look and kind of make a determination on how you want to use those funds.
And there's we could probably spend a whole hour talking just about how to track those kinds of expenses. If there's anywhere where we see people probably not fully capturing cost, it's in taking a look at the, all of the efforts that department heads and the administrator and the DON and everybody else spent, in addition to the infection control preventionists and other people who are obviously connected with this, to make sure you're not overlooking costs. If there's one thing we have seen in the number of, when we've done analysis of the items accumulated for reporting, is that costs tend to be understated rather than overstated.
Yeah, excellent.
And go ahead.
I was just going to say, you want to take us through the slide?
22? Yes. So this is we're talking about reimbursement from other sources. So you've got to go ahead and identify when you received COVID-related expenses by amounts derived from other sources. So this would be if you directly billed a private pay patient example for something that was COVID-related expenses, or if commercial insurance allowed you to do that. Under the Medicaid program, we already addressed the fact in particular that some states provided extra funding on a per day basis or on other methods for COVID related expenses. So those have to be reported. And there's a frequently asked question that was added on June 11th of 2021 in that FAQ document that goes into a lot of detail about what kinds of funds they're talking about here. So I think that might be helpful if you have any additional questions.
Excellent. Thanks.
And then I think, Andrew, you're going to talk about step number 10.
So this is an area where we're getting a lot of questions, and there's some confusion because when you look at the workbook, the work papers, it's not always completely straightforward. But so you go through step 8 and step 10, where you report your infection prevention control expenses if you have any infection control monies, and then you report your other COVID-related expenses to offset your other PRF payments. And as we said earlier, you only report those expenses up to the amount of funds that you received. Mm-hmm. And so in step 10, then you're going to report your total unreimbursed expenses after application of all other assistance and PRF payments. So think about it like this. The way I like to, or at least the way I like to think about it is, steps 8 and 9 are for the expenses that are being used to support the PRF payments. Step 10 details what remains unused. So if you take an example of a provider that had $100,000 in PRF payments and $150,000 in expenses, you would report $100,000 in expenses because that's all the payments you had for this reporting period. You would have $50,000 in unused expense, and that's what would get reported in step 10. If you were a provider that had $100,000 in PRF payments and only $50,000 in expenses, you would report the $50,000 in expenses. You would still have PRF funds left over that would be applied then to lost revenues, and you would report 0 in this step because these are because that's the remaining expenses that you have. And I think we're getting a question here, all funds received. So for purposes of step 10, you're reporting expenses net of everything, including all other assistance received and all the PRF payments. Essentially, the government's asking here who has expenses that were left uncovered for this first round of reporting before we start talking about lost revenue. There's a worksheet, once again, as part of the portal worksheets that you can go and look at, and will help fill this out. I also recommend that you read the user guide. The user guide walks you through the actual mechanics of the reporting process in greater detail.
And this really that's an incredibly important step, because as we said, this is your opportunity to demonstrate to the government exactly how much this cost you. You can't, who knows if that will be used for future distributions. So this is such an important piece of information here that you're accumulating.
Yeah, and that's a great point. We've had a lot of clients say, well, as long as I use it all up, what does it matter? We're strongly encouraging you, or would strongly encourage you, go ahead and go through now, develop all your expenses, every single expense dollar you possibly can, because we don't know how the government may use this reporting information, for example, to set a new round of funding at some point down the road. So step 11, revenue reporting. So now we get into the other big piece of kind of the meat, the place where everybody's interested. So the data entry for step 11 is another one of those dynamic data entry points. So if you reported if you used up all your PRF expenses or all your PRF funds in step 9, and you don't have any PRF funds left after applying the expenses, when you get to step 11, you're simply going to be given 2 boxes. It's going to be annual revenue for 2019, annual revenue for 2020. You're done, and you'll skip on to step 13. If you have, if your other PRF payments from step 6 were greater than the expenses you received, then the portal is going to take you to what is called the lost revenue questionnaire. And that's where you as the provider will be selecting one of the 3 methodologies available for calculating lost revenue. And Claudia, let's jump in here, and you want to take us through what is revenue for purposes.
I am so excited to be talking about this because if there is one question we've been getting, it is, what does it mean, or did it mean in previous guidance when it said that you exclude contractual allowance from determining your patient care revenue? So we are so happy to let you know that it has finally been confirmed in the updated FAQs as of August 31st, that when they said that you exclude contractual adjustments, that means what you're reporting is net collections for patient care revenue. In other words, you don't collect, we all know we record charges, but that may not bear any relationship to the amount that we actually receive under the Medicare program, which is typically less. And those charges that are associated with Medicaid patients are the same, that, what we get is likely less than what our charges are. So we're going to have a contractual allowance for that. And we know if you think about hospitals have huge differences between their charges and what they actually collect for a number of reasons. But this has finally been clarified, so no one should have any more questions or confusion, even though there's been a lot of confusing publications out there. We are talking about revenue is net charges, net collections, net of contractual allowance, charity allowance, bad debts, etc. That's the number, that's what you're going to be reporting as net patient care revenues. The revenue should not include non-patient care revenue, and there's been a lot of FAQs that deal with this. So if you, obviously, if you have assisted living or independent living, the fees that you collect from those residents are in the category of patient care. But if you have other non-patient care related real estate that you're renting, or those kinds of real estate revenues that aren't connected with patient care, if you have prescription sales revenues, except if you have 340B program revenues, then you're not gonna, if you have a pharmacy and people come in off the street and they pick up their prescriptions and they go and they're not residents in your community, that's not something that you're going to report. So there has been a lot of clarification with this, and I think when you go through the FAQs, it will help. The reporting is done by quarter and broken out by payer mix for each of those quarters within the reporting period. So you're going to need to be able to separate your revenue in those quarters, calendar quarters, between Medicare Part A, Medicare Part B, Medicare Part C, which is your Medicare Advantage, Medicaid, and CHIP, commercial insurance, any self-pay, and anything else that falls into that other category.
Excellent. Claudia, before we get to the next slide, I'm just going to, guys, I see some questions coming through. We're probably not going to be able to take any more questions. Just keep putting them in the chat, and we will we'll document them and get back with everybody. If you have a question, don't feel free to stick it in the chat, and we will be happy to to come back. So,
and one thing we should mention here, in the interest of full disclosure, is that we have not yet released our question list from the last seminar. So we will be sending, we apologize for that, but it's taken longer. We had so many questions, it took longer than we anticipated. So when we send out questions we will be sending out that list, and we will also be sending out a full list of all the questions received before the presentation, during the presentation, after the presentation, to make sure everybody has that as well. So we apologize for that little bit of a delay there.
all right, Cardi, you want to take us through quickly the three methods for calculating lost revenue?
Yeah, the three methods. This is really has been tweaked just a little bit. So just very quickly, option number one is where you're just going to do a year-over-year comparison of 2019 net patient care revenues to 2020 net patient care revenues. Obviously, that's not going to be for many people, that might not be where they need to go because their circumstances and a lot of factors may affect that. If that's the case, then you have option number two available. And one thing that's important to understand with respect to option two is that it's based on a budget for 2020 and 2021, assuming that those two calendar year budgets have been approved prior to March 27, 2020. Now, for many of you, that means option two will no longer be available because you most likely didn't have a budget for the calendar year 2021 that had been approved officially prior to March 27, 2020. And obviously, the reason why that date is important is that's when the public health emergency was declared. So they don't want any budgeted information to be potentially manipulated based on that declaration of a public health emergency. So that is going to mean option three is going to be possibly the best alternative methodology for estimating lost revenue for a number of providers. So briefly, this is going to include a narrative document that describes the methodology that you're using, why that methodology is reasonable, and an explanation as to how the losses are attributable to the coronavirus. And you have to include a calculation of lost revenues using this methodology. And it's important to again say that option three continues to potentially have providers who might be might have to face an increased likelihood of audit. And if the HRSA determines the methodology is not reasonable. So there's a lot that could be discussed here in terms of all sorts of types of data that you have in your systems that you may not be thinking about that can enable you to support the methodology that you're using under option three. And that's all the time we have for this, really. But we would not discourage you from using methodology three if that is the most appropriate for your situation. And we do think there are a lot of ways that you can use data that's currently available within your medical record and other statistical systems that you maintain that can help support that.
Hardy, we'll touch on this a little bit more as we go through the reporting steps, but I do want to, and I will specifically address, we're getting some questions on how you may be, we have some thoughts on how you may still be able to use your 2020 budget, but this was a major clarification that came out in August, late August, that they are, if option two, they are requiring you to have a budget that covers the entire period of availability, which means you have to have a budget that covers not only quarters 1 through 4 of 2020, but quarters 1 and 2 of 2021. I'll talk about this a little bit more here, in just a minute when we get to that reporting piece. Step 12, lost revenues.
Oh, is this me?
Yep, I think so.
Sorry. So if step 12 is lost revenues, if you completed the actual revenue data field at step 11, that all other PRF payments were used by the expenses, then the portal will automatically skip step 12 for you. In this particular case, if you selected a lost revenue methodology because you have additional funds left over, then the portal will automatically provide the fields that you need in order to do that. One thing I did not mention in that discussion is that if you do have a budget for 2020 that was approved prior to March 27th, but you don't have one for 2021 that was approved by that date, then you can use a hybrid method through option number three, right, Andrew? Is there anything?
No, I'll touch on that here in just a minute, but yeah,
Oh,
that
okay,
is,
okay.
that
Didn't mean
is
to get
how we're,
ahead.
that is what we would recommend. So I know we're getting some questions on that. So really quickly then, walk through the steps here. Lost revenue, option one. If you select option one, it's very simple. You're just entering your revenue from patient care by quarter for 2019, 2020, and Q1 and Q2 of 2021. It's essentially 10 blocks of information um, that you're putting in. The if you're if you're selecting option two, then you're providing budgeted to actual revenue. And so once again, this is something that came out in late August. It was part
Right.
of the new lost revenue. It was really clarified, I think, for the first time for me in the lost revenues guide that was published when the HHS moved everything over to the HRSA website. And we started seeing the language that you have to have a budget that covers the entire period of availability. And note this, it is very confusing because much of the guidance, many of the worksheets, much of the language HHS has used will still say a 2020 budget. But when you look at the actual, the reporting guidance that was updated
Yep.
a week or two ago now, it is now saying it has to cover the entire period of availability. And so presumably that means if you have a budget that was approved prior to March 27th, 2020, but it doesn't cover the first two quarters of 2021, in theory, it sounds like you can't use that. And so how do we address this? We know this is a big issue for
Yeah.
a bunch of our clients. We know very few of our clients have a multi-year budgeting process. They typically are budgeting at the end of the year for the prior year, and they wouldn't have started 2020 budgeting process until well after our 2021 budgeting process until
Right.
well after the March 27th cutoff. And so, um, so if option two seems like eliminated, what should you do? And, unlike the cat here, you got to think outside the box a little bit, right? And so what we're suggesting in our recommendation in light of this, unless we get some more guidance that clarifies this issue, which certainly could happen, is that you would select option three. And so option three will give providers the option to enter their lost revenue for Q1 through Q4 and then Q1 and Q2 of 2021. So the actual data entry for option three is literally just 6 boxes. It's your lost revenue in each of those quarters. But then, as Claudia said, you have to provide a narrative describing the methodology, explaining why it's reasonable, a description of how lost revenues were attributable to coronavirus, a document detailing your calculation, and a single additional supporting document. In theory, option three is going to be subject to an increased audit risk, and that's something you have to be aware of. But what we would certainly suggest for providers, and going back to what Claudia was just touching on, if you have a budget that otherwise meets all the criteria for 2020, but it doesn't cover 2021, you won't be able to enter the box for option two because you won't have budgeted numbers and you won't be able to submit an approved budget that covers the first two quarters of 2021. But what we would recommend is use that budget to fill in your revenue as your revenue projections under option three, and then use some simple either just recycle those budget numbers for the quarter one and quarter two of 2021, or recycle them maybe with some kind of a cost of living increase or a GDP growth factor to increase that revenue number. Submit that budget and submit the same attestation you would submit under option two, just submit them as supporting documentation for option three. And our opinion is that if you do that, even if you get audited, HRSA is going to have a very difficult time disputing your lost revenue calculation for 2020 if it's based on a budget that otherwise would have been usable or suitable under option two. It just doesn't cover the first two quarters of 2021. And so we think that's probably the most logical workaround for this situation. We certainly recognize that it is going to create there's a lot of confusion about this, and HHS/HRSA has not helped because they still continue to use very confusing language and terminology. when they're talking about these options. So then the reporting summary. So once you fill everything in, step 13 is very simple. It's going to give you a reporting summary, which you'll review, that summarizes all of the information that you put in the portal to date. And if you'll have an opportunity to review that. The portal guide gives you kind of a matrix to decode where all that information is coming from. And if you see an error, what steps you need to go back to correct that. So once again, the reporting guide is very, very useful there, and it will take you back and help you sort that out. Claudia, step 14, metrics. This is another place where I know we're getting a lot of questions.
Yeah, and this is one of those, in this particular step, I think these questions come up when you try to start figuring out how to input all this information. So what this is covers certain personnel, patient, and facility metrics. So you have clinical and non-clinical staff by labor category, so that's employees and contracted labor. You have inpatient admissions and facility stays, which is what it says, not patient days. If you're a nursing home, we don't often think of facility stays. That's more of a hospital, mechanism. And the total number of staffed beds. One of the questions that we've gotten that's very common, and we'll try to cover this one at least, is that when it comes to that contract labor, who do you include? I mean, we've had questions about, we have a lot of contract people coming into our buildings. They may be cleaning our vents, they may be doing maintenance on our air conditioning system, et cetera, but they're not someone who is on a scheduled basis or a regular basis coming into your facility. So if you have somebody like a dietitian who comes in regularly under contract, or a medical record person under contract, or pharmacy consultant, or medical director, those are people that you're obligated to have and would come in with some regularity, and you would probably try to want to consider them, remembering though that these metrics of individuals can only be coded or reported as whole digits, so you can't put in fractional amounts. So don't get too deep into the weeds here. I think when you're trying to accomplish this reporting, I think that's probably all I can say about this time. So if you have additional questions, just put them in the portal and we'll be happy to address those after the presentation. Then go ahead.
No, survey and submission.
Okay, survey and submission. This is a provider survey. They're asking you, what has been the impact on your business as a result of COVID? Here is your chance. What has COVID enabled? What have these PRF monies enabled you to do? How did they help you maintain solvency? How did they retain staff, et cetera, et cetera? This is your opportunity to say to the government, this is what it's helped us with. And in combination with the other schedules or the steps that include the unreimbursed expenses you have, will be a way of demonstrating where you stand, what you've been able to accomplish, where you still need help, et cetera, et cetera. I think that's all we can really talk about at this point, right, Andrew?
Yeah, we're quickly running out of time. We are at questions, and so
we also have these resource slides. Just let me cover those really quickly. But these are the new HRSA resources. If you've been used to HHS, this is going to really aggravate you more than likely, unless your personality is much more sedate or than mine. But it's going to take a little bit to be able to find where some of this information is, but we can assure you that it's all there.